Hi there, and welcome to Senior Benefit Illinois. My name is Lee DeHart. If you're approaching age 65 or helping a loved one with their healthcare planning, understanding Medicare can feel overwhelming. But don't worry, I'm here to break it all down for you in simple, plain language. This is your Medicare 101 guide. Let's get started. Medicare is a federal health insurance program mainly for people age 65 and older. It also covers some younger individuals with certain disabilities or end-stage renal disease. Medicare is made up of different parts, each covering specific healthcare services. Let's take a look at what each part does. Medicare Part A is your hospital insurance. It helps cover inpatient hospital stays, skilled nursing facility care, after a hospital stay, hospice care, and some home health care. Most people don't pay a monthly premium for Part A because they paid Medicare taxes while working. Medicare Part B covers outpatient and medical services. This includes doctor visits, preventive services like screenings and vaccines, outpatient care, durable medical equipment, and some home health services. There is a monthly premium for Part B, and the amount depends on your income. Medicare Part C, also known as Medicare Advantage, is an alternative to original Medicare. These plans are offered by private insurance companies approved by Medicare. A Medicare Advantage plan combines Part A and Part B, and often Part D, and may offer extra benefits like vision, dental and hearing coverage, fitness memberships, and transportation to doctor appointments. However, these plans may have more limited networks than original Medicare. Medicare Part D helps cover the cost of prescription drugs. It's offered through private insurance companies and can be added to original Medicare or included in a Medicare Advantage plan. Every Part D plan has its own list of covered drugs, called a formulary. Be sure to choose a plan that covers your medications. Medigap plans are extra insurance you can buy from private companies to help pay for costs not covered by original Medicare, such as deductibles, copayments, and coinsurance. You must have both Part A and Part B to get a Medigap plan, and these plans don't work with Medicare Advantage. There are key times to enroll in Medicare. The initial enrollment period, or IEP, is a 7-month window, 3 months before your 65th birthday, the month of your birthday, and 3 months after. If you miss your IEP, you can sign up during the general enrollment period from January 1st to March 31st each year, but late penalties may apply. During open enrollment from October 15th to December 7th, you can switch or join a Medicare Advantage or Part D plan. Lastly, during the Medicare Advantage open enrollment from January 1st to March 31st, you can switch Medicare Advantage plans or return to original Medicare. Medicare isn't free. Here's what to think about. Part A is usually free, but hospital stays may have deductibles and coinsurance. Part B has a monthly premium and an annual deductible. Medicare Advantage and Part D plans may have premiums, copays, and coinsurance. Medigap plans have monthly premiums too. Choosing the right combination of plans depends on your health needs, your budget, and what doctors or hospitals you want to use. Part A is usually free, but hospital stays may have deductibles and coinsurance. Part B has a monthly premium and an annual deductible. Medicare Advantage and Part D plans may have premiums, copays, and coinsurance. Medigap plans have monthly premiums too. Navigating Medicare can feel like learning a new language, but once you break it down, it becomes manageable. Start by asking yourself, do I want original Medicare or a Medicare Advantage plan? Do I need drug coverage? Should I consider a Medigap plan? Talk to a licensed Medicare advisor to explore your options. Getting the right coverage can give you peace of mind and help you save money in the long run. Thanks for watching Medicare 101. If you found this helpful, don't forget to like and subscribe for more straightforward explanations and updates. Have questions? Drop them in the comments. I'm here to help. Take care and see you in the next video.